There are retraction pastes that are available, and this has really saved me in my practice. So in my hands, a lot of my colleagues and myself are finding the Traxodent very easy to use. It's easy to dispense, and it flows very well. It's got a hemostatic agent, it's 15% aluminum chloride, and it also serves as a retraction mechanism because it does displace tissue. And it's almost a clay-like consistency, but it helps dry the sulcus, and it does have an affinity for blood, so it's kind of nice that way. When do I use it? I'll use it before a procedure when I need to dry the field out at all, and before taking an impression, before doing an optical scan, and getting rid of any crevicular fluids. The cavity preparation always needs to be dry, so when applying a bonding agent and a composite, the field must be free of blood and crevicular fluids. So I'll even use it in cosmetic procedures as well, so that comes in very handy. So even if I've got a restorative case where I'm doing a DO on a posterior molar and there's some bleeding from around there, I can place the material in there and it will actually serve as a nice hemostatic agent. As long as you clean it off completely, it will not alter the bond strengths. So there are times where I will just place the Traxodent and nothing else. I won't put any compression, I won't put any retraction cord, and it works fine. There's other times where you need to actually put what's called a retraction or compression cap on there, and they come in 3 different sizes. You trim it to fit the preparation properly, and you apply 2 minutes of pressure on top of it, and then it's not a cotton roll, they're actually a little stiffer, but you can trim it to fit the tooth, and then you can get a nice clean dry preparation. You can combine the two where you'll have a cord and Traxodent, and in this case the cord is placed, Traxodent is placed over top of it, and then it's rinsed off, and you get a nice clean restoration as well to be able to take an impression or a scan. If you're using the Traxodent cap, again, you want to adapt the cap so it fits. It's not like this. You've got to trim it so that it fits properly around the tooth, and you can take scissors to trim that very easily. It expresses quite easily, as I said. It's very user-friendly. Probably a little bit more than what you need right here, but you place it right into the sulcus, and then the retraction cap's left on for 2 minutes, and then it's thoroughly rinsed off, and you can get some really nice detail if you have good preparation. So once again, the last thing about the Traxodent is that you can bend the tips, so it really allows for easy application wherever you need that. I mentioned about the bond strengths. It does not affect the bond strengths of your preparation, so that's a nice thing.